Now that we have covered all the scientific and medical aspects, we will now focus on the patient perspective together with Tiffen. Tiffen, thank you very, very much for being with us today. You will share your journey with a rare metastatic neuroendocrine tumor. And I believe your testimonial is very important for those who are facing the same situation, right? Tiffen, could you please share with us when you were diagnosed with NET and what the first months were like?
So I was diagnosed 9 years ago with a stage 4 metastatic neuroendocrine tumor. The discovery came unexpectedly because I had abdominal pain and I was sent to do a CT scan that revealed some masses both in my liver and my small intestine. They finally gave me the diagnosis, and it was called a neuroendocrine cancer. At the time, I was shocked, and I was only 40 years old. I was raising 2 children with my partner. I thought that I was going to die within the next 3 months, and I remember being completely lost.
Could you please describe your treatment journey so far?
So I went through 2 major surgeries within 9 years, or 8 years, let's say. And the disease does stop and go. It stops, it stabilizes, and then it goes back. And every time you have to change treatment, or you increase the dose of your treatments. And last year, during a routine exam, I had to change treatment again because, unfortunately, the disease progressed. And so my doctors, instead of offering me things like surgery or other things, they told me that I needed a more systemic approach because the disease progressed in different parts of my body. And so they offered me radioligand therapy.
Could you please share with us how it went?
So that was last year when I did some routine exam because I have to do some MRI and CT scan from time to time and blood test and so on. And unfortunately, after 8 years, my disease still progressed. So I had to change line. And thank God I was eligible because within all the patients, unfortunately, you have 20% of the patients that don't have those cancer receptors. So I was ticking the box and very well, apparently, because you have a grading. And I went to do this treatment back in January 2025. It's a series of 4 injections with 2 months apart. And the way it works is you get in at the hospital in the morning. They inject you different products, something that is an anti-nauseous, not caused by the radioactive product, but by the amino acid that protect your kidneys. And then once you have those 2 products injected, you are in a lead protected room because you are radioactive. And the doctors come in and they inject you the radioligand therapy. It lasts about 30 minutes. You don't feel anything. Seriously, I was thinking that maybe I will be hot or feel something in my vein or glowing or whatever, but nothing happened. It was like completely neutral.
So now, Tiffen, you have received the whole treatment. Do you feel any side effects?
So every time I did an injection, after a few days, let's say 3 or 4 days, I felt very tired, no energy at all. Maybe it's the aftershock, psychologically you are a bit lost because you expect so much and you don't really know what's going to happen. And when you see that there is nothing, you're more relaxed, so your body calms down and you feel very tired. Maybe it's the treatment as well, I don't know. Then you feel a bit nauseous. You lose a little bit of appetite. At least this is how I felt. And usually, for me, after 3 weeks, I lost a little bit of my hair. When I brushed them, I could see that they were falling down, but it grows back. and I have a lot, so it's okay. But yeah, that's the main side effects I got from this treatment.
Thank you, Tiffany. So you received the whole treatment. You have barely side effects. Today, do you already have some results of the treatments? And what does your quality of life looks like today?
They tell you that it should offer you stability for a long time. And this is what I'm hoping. So basically, I'll do my next exam in January, and I'll have more view on how efficient the treatment has been. But I already have some clues. First, usually you have to do a series of imaging between the cure 2 and the cure 3. And those imaging that I've done back in April show stability, so no progression, which is already an indication. And the second thing is physically, I feel less tired. First, because I don't have bi-monthly injection that I used to have before the radioligand therapy. They reduced the number to once a month, and this treatment made me very, very tired. So I don't have this treatment anymore. I only have it once a month, which makes me more energetic. And the other thing is I used to have some pain around my liver because I know I have lesions around there. And I couldn't, for instance, sleep on my right anymore. But since I have this treatment, probably after the second injection, now I can lay down completely all over in my bed, and there is no problem anymore. So for me, it's an indication that maybe the tumor has diminished in terms of size, and we'll see in January.
Mm-hmm. Thank you very much, Tiffany, for your openness. Of course, we wish you all the best for the rest of your journey. And what you have shared today with us will certainly guide those who are living the same situation. Thank you very much for that.